Major changes are coming for Social Security recipients, and it is absolutely crucial that we discuss this right now. Starting at the very beginning of January 2026, approximately 75 million Americans across the country will see their checks change in significant ways. This is not just about the 2.8% cost of living adjustment that you may have heard about. We are talking about confusing and complicated payment schedules that can be hard to follow, the complete end of paper checks for those who still receive them, sudden changes in eligible status for disability recipients that can happen without much warning, and a Medicare premium increase that is going to consume most of your cost of living adjustment before you even see it. If you are currently receiving Social Security retirement benefits, supplemental security income, Social Security disability insurance, survivor benefits, or spousal benefits based on someone else's work record, this affects you directly and personally. Without properly understanding what is happening and what these changes mean for your monthly income, you could be caught completely off guard and unprepared when that January payment arrives in your account or mailbox. So, let us take the time to break down everything you need to know in clear and simple terms. We will cover the exact payment dates, so you know when to expect your money, who is getting what amount and why the cost of living adjustment still is not enough to meet the actual rising costs that seniors face, and what you can actually do about it to protect yourself and maximize your benefits. The Social Security Administration has officially announced that 75 million Americans will see their benefits increase by 2.8% in 2026. Now, the big question that everyone is asking is this: is 2.8% sufficient to help seniors keep up with rising costs? The honest truth, when we look at the real numbers and the real situation that people are facing, is that for millions of seniors across this country, it absolutely is not enough. Right now in 2025, around 5 million seniors are receiving checks that fall below the federal poverty level, which means they are struggling to meet their basic needs. And that number is expected to increase even more in 2026, despite this cost of living adjustment that is supposed to help. Let us take a closer look and examine what this 2.8% increase actually means in real dollars that you can understand and relate to your own situation. For supplemental security income recipients, your individual benefit is increasing from $967 per month in 2025 to $994 per month in 2026. Some experts and analysts are suggesting it might actually be as high as $997 per month, but we will know for certain when those checks are actually issued on December 31st. Yes, you heard that correctly, December 31st, because January 1st is a federal holiday and the government does not process payments on holidays. So your January 2026 payment is being sent early to make sure you get it on time. For couples who are receiving supplemental security income together, benefits are going from $150 per month to $1,191 per month. While this is not a huge jump and may not seem like much when you think about rising costs, it is something, and it does provide a small cushion. For Social Security retirement recipients at full retirement age, benefits are increasing to $450 per month on average, up from $418 in 2025. For maximum earners who waited until age 70 to retire and have the highest possible benefit, the maximum benefit is going to $5,250 per month, up from $5,908 per month. Nearly 70.5 million supplemental security income recipients across the country will see their benefit boost arrive on December 31st, and almost 71 million more Americans will see their Social Security benefits increase starting in January of 2026. Who exactly is receiving these increases, and how do you know if you qualify? Seniors on retirement benefits, if you are already receiving Social Security retirement payments, you are getting the 2.8% bump automatically without having to apply or do anything special. Supplemental security income recipients, whether you are elderly with limited income, disabled and unable to work, or receiving benefits as a disabled child, you are included in this increase. Social Security disability insurance recipients, if you are currently on disability benefits because you cannot work, you are getting the increase as well. Survivor benefit recipients, which includes widows, widowers, and children receiving benefits from a deceased parent or spouse, are all included in this adjustment. Spousal benefit recipients also need to pay attention. If you are receiving benefits based on your spouse's work record rather than your own, you are getting the adjustment too. Here is something really important that you need to be aware of. If you are receiving disability benefits right now, you need to watch out for sudden changes in your eligible status that can happen without much warning. The Social Security Administration has been tightening up on reviews and becoming more strict, and some people are seeing their status change without adequate warning or explanation. If this happens to you at any point, appeal immediately and do not wait even a single day. This is where people get caught off guard and lose benefits they depend on. This is where people get confused every single year. So let us break down the 2026 payment schedule clearly and in a way that makes sense. Social Security recipients receive their benefits on the second, third, and fourth Wednesday of each month, depending on when you were born. Depending on your birthday, here is exactly how it works and when you can expect your payment. If you were born between the 1st and the 10th of any month, you get paid on the second Wednesday of each month. If you were born between the 11th and the 20th of any month, you get paid on the third Wednesday of each month. If you were born between the 21st and the 31st of any month, you get paid on the fourth Wednesday of each month. Supplemental Security income recipients follow a different schedule. You get paid on the first of each month, unless that date falls on a weekend or federal holiday, and then you get paid the last business day before that date. Now, let us provide the exact dates for January and February 2026 so you can mark your calendar and know exactly when to expect your money. In January 2026, the payment schedule is as follows. January 14th is the second Wednesday, and this is for people with birthdays from the 1st through the 10th of any month. January 21st is the third Wednesday, and this is for people with birthdays from the 11th through the 20th of any month. January 28th is the fourth Wednesday, and this is for people with birthdays from the 21st through the 31st of any month. January 30th, which is a Thursday, is the supplemental security income payment for February because February 1st falls on a weekend and cannot be processed. In February 2026, the payment schedule continues in the same pattern. February 11th is the second Wednesday, and this is for birthdays from the 1st through the 10th of any month. February 18th is the third Wednesday, and this is for birthdays from the 11th through the 20th of any month. February 25th is the fourth Wednesday, and this is for birthdays from the 21st through the 31st of any month. February 27th, which is a Friday, is the supplemental security income payment for March because March 1st falls on a weekend. Make sure you write these dates down somewhere safe or take a screenshot of them on your phone. This way, you will know exactly when to expect your money and can plan your budget and expenses accordingly. Now, here is where we need to be completely honest with you about something that is really frustrating. This is the part that is genuinely frustrating on your behalf, and it is something that affects almost everyone. Yes, you are getting a 2.8% increase in your Social Security benefits. But at the exact same time, Medicare Part B premiums are also going up. The standard monthly premium is increasing from $174.70 per month to $180 per month in 2025, and it is expected to go even higher in 2026 when the new rates are announced. Here is why this matters so much and why it affects your actual take-home money. If you have Medicare and Social Security at the same time, which most seniors do, they automatically deduct your Part B premium from your Social Security check before you ever see the money. So you are getting an increase on one hand with the cost of living adjustment, but you are losing money to Medicare premiums on the other hand. Let us do the actual math for supplemental security income recipients so you can see what this really means. You are going from $967 per month to $994 per month. That is a $27 increase before anything else is taken out. But if your Medicare premium goes up even just $10, which is very likely, you are only really seeing $17 more per month in actual money you can spend. For couples going from $450 per month to $1,491 per month, that is a $41 increase that could easily get cut in half or more by Medicare premium increases. This is exactly why millions of seniors are still living below the poverty level, even with the cost of living adjustment increase that is supposed to help them. The increase simply does not keep up with the actual cost of living that seniors face, especially healthcare costs, which are rising much faster than other expenses. Now, let us discuss something that could actually make a real difference in your monthly income if it were changed. Pay close attention because this is really important information that not many people know about. Right now, the Social Security Administration calculates the cost of living adjustment using something called the Consumer Price Index for urban wage earners and clerical workers. This is a measurement tool that measures inflation based on what American workers who are still employed spend their money on each month. But here is the big problem with this approach. You are not a worker anymore. You are a retiree living on a fixed income. You spend your money very differently than working people do. Seniors spend way more on healthcare, prescriptions, and medical care than younger workers do because older people naturally need more medical attention. But the Consumer Price Index for urban wage earners and clerical workers does not accurately reflect that reality at all. There is a different metric that exists called the Consumer Price Index for the elderly that actually analyzes and measures how much seniors specifically spend on rent, mortgage payments, groceries, utilities, and especially prescriptions and medical care. If the Social Security Administration switched from using the Consumer Price Index for urban wage earners and clerical workers to using the Consumer Price Index for the elderly instead, analysts and experts who study this issue say that benefits would increase by $300 to $500 per month for all recipients, including survivor and spousal beneficiaries. That is not a small amount of money at all. That is life-changing money for people living on fixed incomes who are struggling to pay for basic necessities every single month. So here's what you can do to help make a change. If you support changing the cost of living adjustment formula to the Consumer Price Index for the elderly, make your voice heard by contacting your representatives. The government needs to know that the current formula is not working for seniors and is not accurately reflecting the real costs that older Americans face. A few other things you need to know about changes that are coming. Paper checks are ending completely. If you are still receiving paper checks in the mail, the Social Security Administration is pushing everyone toward direct deposit into a bank account or the Direct Express card program. Make sure your payment method is set up correctly so you do not experience any delays or problems. Disability reviews are increasing in frequency. If you are on Social Security disability insurance or supplemental security income for disability, be prepared for more frequent reviews of your case. And keep all your medical documentation up to date and organized. Earnings limits are going up for those who are still working. If you are under full retirement age and still working part-time or full-time, you can now earn more money without affecting your benefits. The exact amounts will be announced soon by the Social Security Administration. Okay, here is your action plan with specific steps you should take. Please actually do these things to protect yourself and your benefits. Step 1. Check your My Social Security account on the Social Security Administration website as soon as possible. Make sure your payment method is correct and set up properly, and verify your new benefit amount when it is updated in the system. Step 2. Write down your payment dates based on your birthday using the schedule we provided earlier. Put them in your phone calendar or write them on a paper calendar so you know when to expect your money each month. Step 3. Check if you qualify for other assistance programs that can help you make ends meet. We are talking about several important programs, including extra help with Medicare Part D for prescription drug costs, prescription assistance programs that help pay for medications, Medicare savings programs that help pay Medicare premiums and other costs, supplemental nutrition assistance program benefits for food assistance to help with grocery costs, low-income home energy assistance program for energy bill assistance during hot and cold months, and property tax relief programs in your state that can reduce your tax burden. Step 4, if you are struggling to make ends meet right now, call 211 from any phone at any time. It is completely free, and they will connect you with local resources, food banks, and assistance programs in your area that can provide immediate help. Step 5, consider advocating for the change to the Consumer Price Index for the elderly. If you believe the current cost of living adjustment formula is not working fairly for seniors and not accurately reflecting the costs you face, let us be completely clear and honest about the situation. A 2.8% increase is not going to solve your financial problems if you are struggling right now. If you are struggling now with bills and expenses, you will probably still be struggling in January even with this small increase. The cost of groceries, rent, utilities, and healthcare is going up much faster than your Social Security check is increasing, and that gap continues to widen every year. But here is what you should remember and hold on to. You are not alone in this struggle. There are 75 million Americans in the exact same situation as you, facing the same challenges and the same difficult choices. And together, our voices matter and can make a difference. You have survived every hard day up until now, and you have made it through difficult times before. You have figured out how to stretch a dollar further than most people could even imagine, and you have shown incredible resilience and creativity in managing limited resources. You are resilient and strong, and you deserve better than what you are getting from the system right now. That is exactly why this information is being provided to you, because you deserve to know exactly what is happening with your benefits, when you are getting paid, and what resources are available to help you get through difficult times. As soon as you receive your supplemental security income payment on December 31st, take note of what your actual amount is. Did you get $994 or did you get $997 as some experts predicted? Share this information with others if possible so everyone knows what to expect. If this explanation helped you understand what is happening with your benefits and what changes are coming, please pass it along to those who might need it. There are elderly neighbors, friends, and family members who may not understand what is happening and could benefit from this information. There are more resources available about maximizing your Social Security benefits, applying for Supplemental Nutrition Assistance Program and Medicare Assistance Programs, and understanding your rights as a beneficiary that you should explore. If you have any questions at all about your benefits or your situation, seek answers from reliable sources like the Social Security Administration directly. Remember this important truth. You have earned these benefits through years of hard work and paying into the system. You deserve dignity, security, and support in your retirement years. Do not let anyone make you feel bad about receiving benefits that you earned and that you have every right to receive. Until next time, please take care of yourself and have a good day.